All right, here we are once again on Compliance Capers, our very last episode in the month of May. Good morning, my friend Betty. How are you?
Good, good. How you doing, Sonal? Hey, y'all.
Good. So this is Sonal Patel with SB Collaborative and Betty Hovey with CHCS Consulting, once again to wrap up our month of May on corporate integrity agreements. Now, I know you guys have had a mouthful of us talking about compliance, right? This entire month on our corporate integrity agreements. But, when my good friend and I here talk offline, this is what we talk about. We still talk about compliance and auditing and monitoring and what's new and what's hot in the news. We talk about this all the time. We are incredibly passionate advocates for our physicians and our practices and entities. And so, when we come up with these concepts for the month, we really want to do something new, something that's not been done, something that not a lot of people know about in terms of our providers. And that's who we really want to direct the majority of our conversations to. Other compliance folks, and of course, our providers. So, we've taken a broad brush throughout the entire month with a variety of specialists, a variety of types of these corporate integrity agreements, as well as our quality types of agreements, as well as these integrity agreements. So, there are those three different sorts of documents that we have been talking about. And so for this last episode, we really wanted to fill the episode with, two items, if we're able to, with our audience today. One is going to be a smaller one, a integrity agreement. And then the other is, of course, a much larger one. A little hint, it's the largest, some sort of $85 million settlement that happened. But once we get to it, I think you'll understand why. But first and foremost, yeah, you guys will get a twofer because, we had so much great quality information to provide you this month. So we gave you, a twofer at the beginning of the month with all of the information we gave you, plus one amazing case, right? And now at the end, we'll also bookend it with another twofer, like you aptly said. So
they already get that with us, right?
You get that with us, a twofer. That's right. So it's all just so cohesive and funny and witty and clever. And yeah, that's what we like. Yep. So this first case that we wanted to highlight, let me pull up the link. It's going to be, of course, regarding our favorite, a actual provider, a physician here.
Mm-hmm.
So, this is a good one because we haven't spoken about a integrity agreement specific to a physician. And when I happened to find this integrity agreement, it also happened to coincide very nicely with previous conversations that we've had here on Compliance Capers regarding critical care services, which I know we talked about in a previous episode.
Yes.
We love to talk about critical care. So, Betty, if you could please tell the audience a little bit more about this particular case that is involving a physician integrity agreement.
Sure. This one is out of New York, and it is from the end of last year, so in September of 23, where a physician that was billing Medicare for critical care services to residents of nursing homes, but it was found that he was actually only providing like routine care. So when you look at it, it's a pretty short release, the release on it, the notice for it, in that they said for the most part, what the physician was doing was routine care such as regular medical checkups, but was reporting them as critical care services. So obviously out of the E&M category of codes, critical care services are the most high paid when you kind of compare them to all the other ones, and with nursing homes checkups, depending on what kind he was doing. If it was like the nursing home, like residential kind of visits, those are kind of on par with clinic E&M visits. So great difference in what he was being paid for the services that he claimed he was doing, which, he actually was not. So this one, the physician agreed to pay a little over $1 million, 1.3 million for conduct that took place. And this was back from the years of 2019 through 2023. So, and because it is a physician specifically, on a smaller scale, like we've been talking about, this is an IA, an integrity agreement, not a corporate integrity agreement. So, going in with our whole twofer thing for today. So we've got an IA and then a CIA. So this is the IA. So this is a smaller one. That's kind of it in a nutshell. He was overbilling for services that he was rendering.
Yeah, that's right. Exactly what we talked about in that previous month, right? That you got to get someone in early for the auditing function, right? Because it could have been caught very early, that it was unnecessary to be using this higher reimbursement code for the critical care. Like I had stated again in that previous month when we talked about it, and a practice was hit again because specific things weren't being audited in terms of a quality assurance audit standpoint. So yeah, very, very similar things here. Because as we can glean from just these couple of pages, like you stated on the DOJ press release, we don't really have much more information other than the fact that this Dr. Aurora was only providing care to the residents of nursing homes. So, that particular bucket of our evaluation and management codes, those are going to reimburse for less than a critical care service. And like we've stated in prior episodes, there's a laundry list of items and things that a provider has to perform to meet the standards and definitions of a critical care service. And so unfortunately here it states that documentation only supports regular routine checkups. So that does not really meet any criteria for a critical care service. The terms, negate each other, right? Routine versus critical care. So yeah, highly, highly fascinating that this physician, again, did not actually use any type of auditing or monitoring service from these few years here, like you had stated, from 2019 through 2023. So at least it was a smaller time frame, but still it can balloon out in terms of the volume of payback that has to be given. So yeah. All right, so why don't we move on and get into the actual integrity agreement here for this Dr. Aurora. And like we had stated, this is a integrity agreement again, so it's going to be a little bit smaller than the large first one that we talked about at the beginning of the month, which was around 50 pages because it was a CIA. Again, this is just a IA, so it will be smaller. It's about 25 pages. And, it's laid out really, really well, like we've stressed throughout the month. It's a beautiful roadmap, in my opinion, for what a compliance program should actually look like. And the OIG spells it all out, that this is a integrity agreement for 3 years, once again, and everything has been signed off on since September of 2023.
Right.
So this particular physician has had ample time, and I'm sure is in the throes of it all with his IRO that he was required to get within 60 days, according to this document. So Yeah, Betty, I would love to know some more of your particular findings on this integrity agreement.
Yeah, when we looked at the appendices for this one with the IRO, we spoke last week about in the IA that we were looking at that the rat stats software that we were discussing was specifically stated in the IA that that is what the IRO had to use. But in this one, if you look in Appendix A, that's where the IRO information is given out. It says in this one that let's see, under C, hold on, let me find the specific responsibilities. So when I move around in these things, it's hard to move around when you have the PDF on your.
When you have the PDF, I know,
IRO
and not the paper.
engagement, qualifications, each review, IRO process. No, I can't find it. Oh, claims, it's Appendix B. I was looking at the wrong appendix. I'm sorry. So if you look in Appendix B, the right one, it says the IRO is going to do the claims review for each of 3 reporting periods. So once again, it's giving the roadmap for what they're going to do, and that they're looking for it from their population of payments, which is a 12-month period. So they're going to the year when they're looking at their audit they're going to have to do. But then on page 1 of Appendix B, under the claims review sample, it's number 2.
Number
It
2.
says that the IRO will select a random sample of 100 paid claims. And then they will review the claims based on the documentation and the Medicare requirements to see if this is medically necessary, appropriately documented, and whether it was coded correctly. So in deference to the one we spoke about last week where they said they had to use rat stats, in this one, it doesn't state that they have to use rat stats, but it does state that the IRO has to select the sample, that the physician can't say, okay, well, here's 100 claims for you to look at. They're going to have to pull the whole year and then go in and randomly sample 100 by whatever means the IRO, wants to do them by. So when we were talking offline, Sonal, I think you were mentioning getting, and that's another one of my hard words.
Your favorite word, statistician.
Thank
No,
you.
that's a great point, you guys, right? Like Betty and I talk all the time offline, and we have amazing nuggets of things that aren't always recorded, right? And so, yeah, that's a wonderful point. That last week we talked about the fact that that document, that IA stated in black and white that this IRO must use rat stats to pluck the random sample. In this particular document, it does not say the word rat stats at all. And so, in our opinion, this IRO is, pretty certainly, I would hope, going to find a qualified and trusted statistician, right? Someone with that background, that education, that work practice. They know how to conduct a proper frame and then get a sample, right? That's what they do. They are qualified. They have that PhD, those years of experience behind them as a qualified and experienced statistician. So yeah, I'm hoping that Dr. Aurora's IRO has found and retained and continues to use for these next 3 years a qualified person that is necessary. But yeah, that's great. What Betty and I do from, every time we read, and I'm sorry, my background is getting so dark. There's a thunderstorm in front of me. I apologize if you can't see me. I can barely see myself. But, the statistician is key. And I think it's really, really important that these types of documents are read thoroughly, right? Like you and I do. And we can pick out this fine minutia that, I think is really integral to following the roadmap properly. So in this case, they don't need to use the rat stats, but it's a really great idea to hire the proper qualified PhD type of a statistician for sure.
Yeah, they do all that number stuff. That's I like my numbers, but not that
But
kind of
not
number.
to that degree,
Yeah,
right? And
yeah,
I don't
yeah.
do numbers at all. So yeah, I could not do any of that. No, I would find the right person and send you to them easily. I can easily do that for you.
Yep. We can hook you up, but
Right.
it's
Exactly.
not in my wheelhouse, as
Not in my
tell
wheelhouse. We
people.
do a lot, but this is not in our wheelhouse. And I proudly say that. I can do many other things, but not be a statistician, please. No. And then the only other thing that I found that was similar in this particular IA that was the same as last week is Dr. Aurora does within the 60 days, he had to have put up a notice for the phone number for the hot tips for the OIG hotline. So that was the number one thing on the compliance program requirements that the OIG instructed him to do. So again, it's not, that he did anything bad or wrong. Just put up the OIG fraud hotline 1-800 number.
Yep.
That's it.
And I wonder if if he has to put that up in the nursing homes that he goes to, or in his obviously in his practice, but he has no. I'm getting down a rabbit hole there, but it just kind of I was like, I mean, he doesn't own the nursing homes, but I guess that's not bad information to put out for people to see everywhere. Just like the stuff about we use outside providers, and so you might get a separate bill. You see all those notices
right.
all
You do
over the
see
place when you go into places.
Yeah. So true. Yeah. Don't really know. But yeah. So I thought that was a fascinating integrity agreement.
Yep.
And so I know he's well underway with the work since the end of 2023. So I think we can move on and start talking about the big one, this bigger corporate integrity agreement that has to do with a imaging company, you guys, cardiac imaging company. So I thought this was a great one to end our month of May on, again, because the DOJ press release itself is very flamboyant, like I like to stress here on Compliance Capers, because the DOJ has a way of writing things, right? And it's really flamboyant. It will catch your attention simply by how it's worded.
Yes.
So I'd love for you to read to the audience, what does it say and why is it so buzzworthy?
Well, the just the headline for the story: cardiac imaging company and founder to pay historic $85 million settlement. So you see the historic thing. There's your hook to make sure you read the whole thing.
That's right.
So this is from, again, the end of last year, October 2023. And it is a cardiac imaging company. And they are... the release says in the second paragraph, all by itself in one line, that this is the largest single district civil settlement in the history of the Southern District of Texas. So huge for them. Huge. And $85 million, that's from one entity, is huge. So the company agreed to pay $75 million plus additional amounts based on their future revenue. And the physician, who is the founder, owner, and CEO, he agreed to pay over 10 million, almost $10.5 million. And they said that they based them on their ability to pay. So, adding them up together, then we've got the over 85 million. I'd be interested about the future revenue part of it, though. They're going to have to be maybe biting on this for a while. So it might even go up over that. But this one is all about kickbacks. When you look at it, the actual release, they talk about that between March 2014 and May of 2023, that the company knowingly caused false or fraudulent claims to the federal healthcare programs arising out of violations of the AKS, or anti-kickback statute, and the Stark Law. Specifically, he allegedly paid kickbacks to referring cardiologists in the form of above fair market value fees of $500 or more per hour for them to supervise the PET scans for patients they referred to them. So again, it's like that one that we looked at where we're going to put somebody in here, that lab one, where it's like, you
Yes.
refer to us and then we'll pay you the
Thank you.
extra. So it's kind of like that too. So it's
That's
like,
right.
you refer to us and we'll give this back to you, and going above it. So
Yeah.
they kind of were pulling that out there. They also alleged that the fee was substantially exceeding fair market value because he paid them for each hour they spent scanning the patients, including the time they were away from the mobile scanning units, providing care for other patients, or were not even on site. So no matter what, if it was their patient, they put them on the clock at this $500 per hour once the patient showed up for the scans. So they were compensating them, even when supervision was not actually provided. So, that's where we're kind of getting into that, where it's just in your face kind of a payoff kind of thing. Now, these guys ended up in a 5-year corporate integrity agreement because of their size, to look at this. But when we get to the corporate integrity agreement, their IRO it's very interesting. It's one that we haven't looked at this month yet, and that you and I were talking about, that we're like, oh, this is really, really different and really cool. But the other thing about this was that this is from a KETAM. So this is a whistleblower suit, was brought by the former billing manager. So in this case, she was kind of looking at what was going on, knowing, yeah, this just is not right. So she must have had some discussions, in my imagining, in my opinion, of how these things normally go, has had some discussions saying, we shouldn't be doing this, and this is over this, and was just kind of put aside by the physician that was the owner, and just like, no, just keep doing it, just keep doing it. And so this lady was like, okay, I just can't, and put out under the KETAM. So she is going to be sharing in that historic settlement that they were made. It doesn't say in here, usually they can get up to like 30% of what's recovered, but here it says the relators, which is what she would be, the relator's share of the settlement has not yet been determined. So they haven't figured out how much they're going to give to her for her whistleblowing. But no matter what it is, if it's $85 billion that she's getting a piece of, it's I'm sure going to be quite worth, what she stuck her neck out for, and doing the whistleblowing. So, these guys are going to be paying, not only originally, but they're going to be paying for a while here, I think.
Yeah. Wow, Betty. Those are some pretty fascinating details that you laid out for the audience, right? And those are buzzworthy, and they get you those hooks, that just draws you into that document. Yeah, for sure. A lot of violations there for anti-kickback and Stark.
Yeah.
Wow.
They did a lot of no-nos.
They did a lot of no-nos. Yeah. And like you had stated, we did touch upon the AKS in the previous episodes with the laboratory and that oncologist. There were some kickbacks that were happening there as well. Yeah.
Yep.
It's not a good thing. And like you said, this is longer. This is heftier. This is for 5 years, right? So yeah, much more than these smaller organizations that we were talking about this month as well. with just the integrity agreement. All right, let me find the link for the actual CIA itself for the
And while
audience
you're doing that,
to,
that just brings a thought to me,
yeah,
for when
sure.
y'all are doing these things in your practices and offering or thinking of offering some kind of tit for tat thing,
Mhm.
for a practice or for someone to do a specific service, make sure you're checking on what the fair market value is, because
That's right.
multiple times in that release, they kept mentioning about the fair market value for things. So that's something that you'll want to make sure that you're checking to stay in compliance with those kind of things. I was at a practice years ago when the AKS and Stark stuff started to come out, because prior, it didn't exist. And when it came out, I was at a practice that we used a hospital organization, a big healthcare system, and we kind of did our payroll and did our EHR and stuff like that through them to get like a better fee for it. But so they weren't employees, we weren't employees, but part of it, they of course wanted our doctors to, refer and to admit to their hospital and all that kind of stuff. And we had surgeons and things like that. So they wanted to make sure that they kind of were looking at this hospital instead of the other hospitals to send their patients to. And that part of it was okay because they were paying fair market for the staff and for that stuff. But where they had to make adjustments was in the office suite that we rented. The was a building that was outside of the hospital system, but it was kind of like a block away, so the physicians could basically just walk over to the hospital to do stuff. And that building where we rented space, they were giving it to them under fair market value. So when the statutes came out, we had to renegotiate the terms of their contract, because they were like, we can't do it anymore because now it's against the law.
Right.
So make sure y'all are checking on that kind of stuff when you're getting into agreements with other practices or other people or for other services, that everything is at fair market value, that you're not getting these. If you find some deal that they're offering you that's like, wow, this is the greatest deal ever, there may be a reason for that. It might not be okay to do it. So just throwing it out there.
Absolutely. That's a great point, right? And this is where you need your trusted consultants, your trusted healthcare attorneys out there. These are the things that they are used to researching for you. They understand all of that criteria. Yeah. Another great point, my friend. Yeah. So, when we take the time to look through this entire corporate integrity agreement, again, it's about 33 pages long. When they signed off on this back in September of 2023, it's for the period of 5 full years for this corporate integrity agreement. The laundry list of their compliance requirements, compliance program requirements are, pretty much the same in terms of the major compliance program
Yeah.
requirements that we're all sort of used to in the industry, where these folks need to find a compliance officer. They also need to develop a compliance committee with several different people. All of those things have to be done within 90 days. So again, that gives the cardiac imaging folks a little bit of time to, find these particular people. And I'm sure they have done so because, again, this was back in September of 2023. But, when you find yourself in this type of a structured agreement situation, you need to make sure that you read all 33 pages to the letter.
Yes.
And make sure that you follow it, that within these set period of days, you have all of these laundry list of items squared away and then filed back in your communications with the OIG, so they can go ahead and check it that, okay, they've followed these steps. We can go ahead and agree that they are in compliance now for our basic requirements here within 90 days. So, they do go into a lot of detail in terms of their main issue, their main violations that were found, which was non-compliance with the AKS and Stark Law. So they have an entire section on their compliance program requirements that are dedicated to that particular. That's new, something that we hadn't really talked about in the previous weeks. And
Yeah,
again,
that's on
because
page
it's
8.
unique. Yeah, that's on page
Right.
8. Yeah. So please, you can go ahead and tell the audience more detail because this is not found in the other documents that we are privy to that we talked about earlier in the month of May. So yeah, I think it's fascinating that they go into such specific detail on what this particular entity has to be aware of starting back in September of 2023. They need to be in the know, and
Yep.
they list it all out. Yeah.
Yeah, on is under D, the compliance with the anti-kickback statute and the Stark Law. They made a whole section, like you said, about it. So you have to do focused arrangement procedures, and they give them the 90 days, like they do with most of the stuff in the CIAs, that they want to, they shall create, meaning they are required to. It's a requirement. It's not if they feel like it. To create procedures designed to ensure that each existing, new, or renewed focus arrangement does not violate the AKS or Stark Law or regulations and guidances related to these statutes. And they shall include the following, and it goes through the listing of creating a tracking system for any new, renewed, focused arrangement and the information services that's specific to one of the other sections here where they lay the stuff out. We'll look at the appendices where they go into the IRO thing, which I thought was real interesting for checking on this. Documenting the names and the positions of the arrangement's covered persons, tracking all
Remuneration. Payment. Yeah. That's a workaround. Yes.
To and from all parties to focused arrangements, documenting, like I was mentioning, all fair market value determinations for any focus arrangement. So now it's telling them before they get into any new arrangement or any existing arrangement, they have to go back and study and do a study on what the fair market value for those services or that space or whatever it is, what that is. And so now they have to actually document it out to prove that they did the work, and then tracking the service and activity logs to ensure that they are performing the services required. Because remember, in the release, it said sometimes they weren't even there. They were just paying them because they referred them there. So they still got that $500 an hour thing just because it was their patient. So now this is saying, okay, now you have to track and make, and say that you've logged out that they were actually performing those services. So they were actually there washing. Now, the imaging thing that this is talking about, and I don't think I mentioned this before, this is relating to PET scans. So that's what the services were that was going through the 78811 through the 78816 as far as CPT codes go. So whether it was just the PET scan or the PET scan with the CT. So those are the things that they're looking at here. And then also to monitor the use of the leased spaces, the medical supplies, medical devices, equipment, all of that stuff. So to make sure it's consistent with the terms in their arrangement, who's paying for what, that kind of stuff, and who's getting paid back for things. And then do written policies, written review and approval processes for these to ensure that everybody is not violating the AKS and the Stark Law. So, and then it lists out what those have to be about what the legal entity is, and the specifying the documenting the business need or the business rationale for the agreement, ensuring that all existing arrangements are subject to the review and approval process. So they have to actually make sure they go through each and every one of them and then certify that they went through each and every one of them. And then the compliance officer has to review the tracking system, the internal review and approval process and procedures on at least an annual basis, and then provide a report of the results to the compliance committee. So, it's not a one and done. They have to continue and to keep looking at these things and then report on it to the committee, and then implement effective responses when they suspect that a violation has occurred or has been discovered, including disclosing that to the IRO and to quantify and repay any overpayments that they may have gotten from that disclosure, that discovery that they made.
Yeah. So huge checks and balances, huge checks and balances that are required for this cardiac imaging company, right? In terms of, the government needs to know that these particular PET scans and, invasive types of procedures are actually being performed, because they clearly got away with many a year for just receiving that above fair market value remuneration for doing nothing, right?
Yep.
Like you had stated in the press release, it says it right there in black and white that, in many, many occasions, the OIG found evidence that, nothing was even being performed, but the payment was received. So a lot of shocking, flamboyant, sentences and things like that are strewn in to these various press releases. And there's so much that we can take away from, right? And we already know the list of CPT codes that are at issue here. There are probably many, many more. These are just a few that they had honed in on, that we could gain more information. But so completely fascinating that this particular CIA talks about all of that, which is new and different, right? Because it's in particular nuance detail with the AKS and Stark Law. So, on that note, the independent review organization here, the IRO, as we were looking at this document, we were like, okay, well, they're not actually looking at any claims, or they're not doing any type of auditing function in the traditional sense of the word, like you and I know the word, auditing claims and auditing documentation. No, the IRO is doing something very, very different in this particular CIA. And they break it down in that Appendix A really, really nicely in this document. Let me just get to it here on my PDF, but it tells you in much greater detail what this IRO is actually, in fact, supposed to do. So this cardiac imaging is going to engage an IRO that possesses these qualifications set forth below, et cetera, et cetera. So let me skip down to section B for the IRO qualifications. So they, in fact, are required to assign individuals to conduct the arrangements review who are knowledgeable in the requirements of the anti-kickback statute, again, the AKS and the Stark Law, and the regulations and other guidance documents related to these statutes. So that's pretty fascinating when we read that in Appendix A, right? Because those are going to be your really, really specialized and trusted healthcare attorneys, right? Who are really going to have a great handle on all of the requirements and the ins and outs of the anti-kickback statute, how this organization can fall safely into some of the laundry list of safe harbors, right? All of that specificity and nuance is really, really well known by our trusted healthcare attorneys, really, really good healthcare consultants that often work side by side with our healthcare attorneys. So this IRO shall also possess expertise in fair market valuation issues or have the ability to associate a valuation firm to assist in conducting the transactions review component of the arrangements review. And finally, third, they shall have sufficient staff and resources to conduct the reviews required by the CIA on a timely basis. And then they also go on into their responsibilities and things like that for how they need to turn things back around and provide it to the OIG. But those three items are very, very different than the other CIA and other IA agreements that we've talked about here during this month of May on compliance capers. So Betty and I really wanted to stress upon the audience that really crucial difference that be mindful and don't just presume that the IRO is only meant for claims auditing and, conducting random samples using rat stats or finding a, reputable statistician. No, they can also do a lot more and provide a lot more expertise, as is indicated in this particular CIA agreement. Yeah, I like this one.
And if you look at that Appendix B too, then it goes into those specifics of
Mhm.
the stuff that the how
That's
they were
right.
putting out in A. This is the skills they have to have, and then in B,
Mhm.
if you look through it, they go through and list out the systems, the policies, the processes, the procedures, and go into all of that minutia in there as
Mhm.
to what this IRO is going to have to be looking at. They're going to be like all up in their business,
Yes.
for this 5 years with these arrangements. Also, too, in the report, what they have to put in their report then is in there
Mhm.
on page 2 under B, arrangements systems review report. So what all the report has to show and describe, and then review their transactions under C right there at the end of page 2.
Mhm.
The IRO is going to have to do 50 randomly selected for focus arrangements that were entered
Mhm.
into or renewed during that reporting period, and then assess whether the company complied with those arrangements and that the requirements described in all the sections, to make sure that they were in compliance with all of that. So that's kind of where the audit, if you will come into, is by them pulling 50 of those
Mhm.
arrangements and looking at them. So just think of the size of this place. If they're pulling randomly 50, how many they have to have, and how,
Yeah.
so this really is a very, very large CIA that you're taking a look at here.
Yeah. Yeah. So fascinating. I loved all of these reports this entire month. I mean,
Yeah.
they're all just so unique. Um, the slant, the scope, everything is so unique. And I know you and I could spend so much more time talking about them all. Um, but, you know, we really wanted this month of May for our audience just to be aware of, what these corporate integrity agreements are, the various
Hmm.
forms of them, right? There are three that we've talked about this entire month,
Yep.
and the various specialties that have actually signed off on them. And they are now being looked at for the period of between 3 to 5 to 6 years, as we've talked about. So, there's so much that you can use from these reports, like we've stressed in compliance capers from week to week, and put it in inside of your own toolbox and try and use some of these roadmaps for yourself, because the way these documents are written by the OIG are really, really well crafted and structurally sound to help multiple practices lay out a proper and compliant foundation to start their practices, to start seeing patients, start doing everything with proactive compliance first and foremost. So I know I loved
You want
it.
to be
I
in
loved
front of
this
it,
entire
not
month.
behind it.
That's right. In front of it is much, much better, right? For sure. For sure.
Yeah. You
Yeah.
never want to get in the backside of the donkey, right?
No, exactly. I mean, look at what we present from month to month on compliance capers, right? You don't want to be hit with one of these types of issues that we've curated out from month to month. No, it's much, much nicer to take a small piece of compliance from month to month proactively. Get in front of your auditing, get an auditing schedule in place. Like we stress all the time, it's much easier to make swift corrected actions immediately rather than pretend that you don't see it, sweep it under the rug, ignore it, just
Yeah.
listen to your neighbor, listen to the other doctor who's doing it without
Yeah.
doing your
It's
own
not going away.
research. Yeah, it's not going anywhere.
Not going
Right.
away.
It's not.
No.
Yeah.
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 Yeah. You pulled good ones this month, a nice variety, and so that we could showcase and highlight something different in each one. So I like that. That was very good.
Yeah. No, I wanted the audience to be aware of the rich variety of practices, providers, and entities that can find themselves in these types of compliance capers, right? And this is why we definitely stress proactive compliance time and time again. And we sound like broken records from week to week, but it's because we really do believe that these smaller bite-sized pieces of proactive compliance can prevent a lot of this, aftermath situation where you can just be practicing great medicine, do everything in compliance, and everything will be fine. That's what we want to see. That's what we would love. So,
yes. Then you don't have to worry about all that other stuff coming up at you.
Exactly right. You can feel confident then that, hey, I got looked at timely. I feel confident that I'm doing it correctly. And when I'm audited, because I listen to compliance capers, when I'm audited by the payer, it'll be okay because I had teams of qualified people look at what I'm doing beforehand and they approved. They told me this had to be corrected. I swiftly corrected it. Now I'm fine. Right? So, yeah, it's a good look. Yeah.
Yes.
Well, all right, my friend. It was so good to have you on this entire month of May, just having these wonderful conversations with me, casual fireside chats on the Corporate Integrity Agreement. I hope our audience got a lot out of this information from week to week. And I can't wait to come back with you and tell the audience what's going to be going on for the month of June. Yeah.
We'll have a whole new slew of things under a different topic to bring y'all in June. So you got to stay tuned.
That's right. Stay tuned, everybody. Well, thank you so much, my friend. I'll see you soon.
Thanks, y'all. Bye.
Bye-bye.